So during your Nclex exam, when they start asking you question on psychiatric category, there are high chances that you will see question on lithium. This is one of the most tested medication on Nclex when it's come to psych category, right? So you must know everything about lithium. So in this video, I'm gonna discuss about lithium, and I will try to cover most of the bullet points which you need to know for your lithium. So I will try to explain you in simple words, and hopefully at the end of the video we're gonna do some practice question and answer, and you will see how easy it is for you to crack most of your answer. So let's discuss about lithium. So lithium, sodium and water, just remember they three are friends. If anything goes drop, the other friend is gonna be angry. So just remember, when I say one friend is gonna be angry, that's mean it's gonna disturb the whole body environment. So just remember that way. So water, sodium and lithium, they are three friends. So let's discuss about lithium. So what is lithium? Lithium is a mood stabilizer medication and is given in the psychiatric condition for bipolar patient. So what is bipolar patient means? So bipolar means two, right? Bi means two, and bipolar means bipolar disorder, right? So that means there are two problems. One is depression and second is mania. So this is given to those patients. Bipolar means depression and maniac. So when the mood is too high or too low, then we're gonna give this medication to control their maniac disorder. Let's say if somebody is very aggressive, like let's say somebody gets aggressive very quickly, like mania. So this medication is given to control their mood, right? So either the mood is too low or too high, lithium will be given to them. Now next thing you need to know, very important thing is this medication has very narrow therapeutic range. So what is that meaning? So this medication range is only, you have to remember their value is 0.6 to 1.2 only. 0.6 to 1.2. How you gonna remember that? You have to remember the table of 6. So 6 times 1 equal to 6, 6 times 2 equal to 12, right? So you just have to remember 0.6 to 1.2 is a value for this medication. If the ranges are below 0.6, that means this medication is not effective. If the value is greater than 1.2, that's mean you will see a toxicity in the patient, and the patient will start showing the symptoms. So that's why we call narrow therapeutic index. That's mean 0.6 to 1.2 only, that is the range for this medication. It cannot go here, it cannot go here, so it should be in between those levels, right? So when the lab value go above 1.2, let's say 1.3, 1.4, 1.5, then we're gonna see toxicity symptoms in the patient. So first toxic early symptoms you will see are GI symptoms. And what are the GI symptoms? So patient, you will see nausea, vomiting, diarrhea, those are the early signs. But if you did not treat it the early signs, then the patient will turn into complicated symptoms. And what are the complicated symptoms? So then it will disturb their neuro. That's mean the patient will you will see confusion, you will see ataxia. Ataxia means the patient is going to be like that, and they will have loss of coordination in between their muscles. So let's say if they're walking, once they put the right leg, they may not feel it, so there are high chances that they're gonna fall, right? Loss of coordination, that's called ataxia, confusion, and tinnitus, which means ringing in the ear. Those are the complicated symptoms you will see if you did not treat early symptoms, right? Let's say if the patient lab value is greater than 1.2, so in that situation what are you gonna do? You're gonna hold the medication and you will let the doctor know, so they're gonna adjust the medication. It should not be less than 0.6, because if it's less than 0.6, that means the medication is not effective. If it's greater than 1.2, that means it's showing its toxicity effect, right? So you have to remember 4 Ds. So first D is dehydration. Dehydration means if the patient is already dehydrated, this medication will cause toxicity. So always patient should have enough water in their body. So you have to tell the patient always drink 1 to 2 liter of fluids in a day. And also do not go outside in the sunlight to do your gardening or this anything related to under the sunlight work, right? Because if they go outside in the sunlight, and they will be more dehydrated, if the water level is drop, the medication toxicity level will be up. So that's why dehydration, remember that. So you always tell the patient to drink 1 to 2 liter of fluid. Next D is drug interaction. What are the drug interaction? So you're not supposed to give to the patient diuretic with thiazide. Diuretic with thiazide. So what are the diuretics? So Lasix or thiazide you don't give this patient, because if you give this to the patient will have too much urine output, right? And same time the patient will lose water as well as sodium. So we don't want patient sodium and water level to be dropped. If the sodium and water level drop, as I mentioned, they are three friends together, right? As I mentioned in the beginning, lithium, sodium and water. If sodium and water drop, the lithium will be aggressive and will disturb the environment. So these three friends needs to be together all the time. So if you give thiazide and diuretic to the patient will urinate a lot, and as well as once the patient urinate a lot, patient will lose sodium as well. So that's why the toxicity level will increase. So that's why don't give thiazide and diuretic to the patient. Another important thing is when you are giving lithium, you should always avoid NSAIDs. What are the NSAIDs? NSAIDs like ibuprofen and naproxen. You don't give it to the patient who is taking lithium, because it will reduce the ability of kidney to excrete lithium from your blood. So that's mean the body will hold the lithium more and it will cause the more toxicity. So that's why you should avoid NSAIDs. Third is decreased kidney function. So what is that meaning? So that's meaning if the kidneys are not working fine and you are giving lithium, that's mean the lithium will not be able to come out, but it will stay in your blood. So that's mean there are high chances that patient will have toxicity level. So that's why time to time you have to check their renal function test. That is very important thing. And also the another thing is renal function test. In what you're gonna check, you're gonna check for creatinine bun level, right? And also remember, creatinine is same as lithium numbers, lab values. So creatinine is also in between 0.6 to 1.2. See, easy, right? Both are same 0.6 to 1.2. And fourth D is decreased sodium level. So that's why if the sodium level is less than 135, so patient should not be hyponatremia. That's mean low level of sodium in the body. So that's why you remember lithium, water, sodium, they are friends. So sodium should not be lower. So what you have to tell the patient? So you have to tell the patient to you can have the salt tablet, or what can you do? You have to tell the patient like keep your diet consistent with the sodium. What is that meaning? Keep your diet sodium consistent, which means whatever the diet you are eating, do not add additional salt or do not decrease additional salt. Whatever the diet you are eating, just keep as it is the way you are eating it. So no need to add additional and no need to lower the salt. So keep as it is, consistent diet. So those are the 4 Ds that you need to remember. And another contraindication is you do not give lithium to the pregnant woman, because it can cross the placenta, and also those who are on breastfeeding. So you don't give this to pregnant and breastfeeding mothers. Those are the important things you need to know. So I want you to re-watch this video and try to write down the important notes, and hopefully once you see any question on lithium, you will be able to crack your answer. So let's practice some question and let's see if you're able to get most of your answer right.